Hello and welcome to a special edition on News9 with me, Sana Sabeen. We are in conversation with Dr. Sangita Reddy at the 13th edition of the Apollo's International Health Dialogue. Dr. Sangita, thank you for joining us at News9. Firstly, congratulations for the success, for the grand success of International Healthcare Dialogue 2026. My first question to you is, patient safety has traditionally been addressed across the nation. In a globally interconnected healthcare ecosystem, how should accountability for safety evolve beyond the borders? If you have one thing to share with us, what would it be?
So I think this is a multi-dimensional question. If you look at it from the interaction between a doctor and a patient, whether it's in the hospital, then the direct responsibility is with that doctor. If you're looking across borders, then most good telemedicine contracts will say that this is advisory because we have not seen the patient in entirety, and therefore the primary physician takes the responsibility, and what you give across borders is advice. But if you take a larger holistic view of this question, then I think there's the governance layer, which is critical. So leadership comes into play. Have they set up the adequate safeguards for patients to understand who's taking responsibility for what? Is the communication methodologies, the privacy aspect of it, is the safety of the environment? So it's a multidimensional question and starts with the government, the leadership of the institution, the hospital, and all the way down to the staff who work. So it depends on the situation, but I'll just say that I think we should all say we're in it together for the safety and the appropriate care of every patient.
So as healthcare is growing and it is becoming more complex, both clinically and technologically, how do you ensure that safety remains foundational rather than being reactive?
So I think because of technology, safety now becomes part of the system. Earlier, when you looked at safety, it was a matter of finding mistakes, doing a root cause analysis, and then trying to educate and ensure this mistake doesn't get repeated. As we evolved, we found clusters and patterns and had a direct linkage between infrastructure, staffing, training of staff, complexity of the patient, and therefore patient safety. As we go further now, you can not only build these safety norms into the system, but you can also predict the lack of safety, and therefore you can ensure that that a crisis does not occur because you saw it into the future. So I think the incorporation of technology is very, very critical. For example, we have a concept called daily rounds or huddle. So the leadership team of that ward, the nurse, the doctor, the phlebotomist, people who are working there, review all the patients on the ward, and they look at what has the consultant prescribed, what's happening to the patient. Because of our proactive use of what is called forward deployed engineering and AI into this, we are proactively saying, yes, the doctor's prescribed this, but you have an ultrasound test tomorrow. Would you like to modify? So the doctor prescribed this, and the response to that medication has been a certain way. Therefore, so all these are not waiting for something to happen and then course correcting, and healthcare was a lot about course correction and trial and error.
Absolutely.
Today it's changed entirely. It's about system built, predictions, and appropriate care happening the first time. So this is a big paradigm shift in clinical care, which will definitely enhance safety, and that's what this conference is all about. That's what Apollo Hospitals is trying to do, to work deeply in the subject of safety, to encapsulate or to hardwire these into our own operating systems, and then to share these systems with other hospitals who are interested.
That's wonderful. As you were talking about digital data and how everything is connected to technology, so digital health is very promising, and we see the impact it is making in the healthcare industry today. But where do patient safety risk increase as systems become more algorithm driven?
So absolutely, what is the use of AI in healthcare? That is using algorithms and embedding them into the clinical workflows, embedding them into the operational workflows. And all these enhance the safety, like I was saying earlier, that you have a predictive environment, you correct any potential problems, and therefore you build a safer experience for every patient.
Now, you also mentioned about leadership taking accountability. So my next question is on that. How do healthcare leaders balance, the speed of digital adoption with clinical accountability and ethical oversight?
When we started in the beginning about this working with technology, we hardwired the laboratory analytics machine into our hospital information system, into the messaging system on the resident doctor's phone.
Wow.
So if you look at the process which it takes to inform from the laboratory to the doctor on the ward that a patient has low blood sugar, you lose time. And with that time, the patient may go into sepsis, shock, coma, any of these things. Here you've saved time. So speed is critical in all interventions. If you look at a patient who comes into the emergency room with a brain bleed, you look at the initial signs, you want to validate this with a CT scan, you put the patient on the CT machine, you bring in, and it's at 2 in the morning, the radiologist has to be called in or woken up, and you send them the image. By the time this happens, the AI has already analyzed and said this is a potential brain bleed. Note the word potential. Then you bring the human in the loop. But proactively, you've got the theatre ready, the neurosurgeon has been called, the trays have been set. If you save 15 minutes over there, you will reduce the injury happening to patients inside his brain. So speed is critical. Now, speed in a particular situation is one aspect. Speed of adoption of these technologies by leadership and governance is a completely other aspect. And this speed of adoption has to be countered with the cost of implementation, the validity of an algorithm and how proven it is, and therefore what is appropriate care. So when you balance building your own technologies, keeping the human in the loop, your risk level is high, your cost level gets reduced, and therefore I think you're able to experiment more and do more. And that's what we're trying to do at Apollo and in India. And therefore, I think it is very powerful for us to say that we will be among the leaders in AI adoption. So if you look at, there's the energy layer, there's the chip layer, there's the application, the large language model layer, then there's the application layer. At least at the application layer, India can be the top. The others were playing a little bit of a catch-up game, but even there we will do very well.
Let's hope for the best for that, ma'am. My next question is a leadership question. Can you share with us your personal leadership practices that have helped you navigate complexity while staying committed to the purpose with empathy?
So there itself you said the most powerful thing, commitment to the purpose. If you have clarity and commitment to the purpose, everything else is peripheral noise. You don't let it bother you because you know where you're going. You know what needs to be done. And I don't think anyone is perfect. There are occasions, there are days where things get you down. There are situations where you feel it should have gone better and why did it happen this way. There are people who don't understand your vision or your purpose and therefore they become detrimental to the speed at which you want to proceed. But the final game is if your purpose is pure, if you're very clear, then you bring in persistence because you know that I'm doing this to bring better healthcare. I know I'm helping to save a life. I will continue to persist and persevere because it is meaningful to do so.
And my last question to you, Dr. Sangita, is if you were to define one leadership legacy for IHD 2026, what conversation do you hope this platform advances globally?
It's all about the patient and it's all about good health. And I think now we're redefining healthcare itself to say we are not sick care, we are healthcare. So it's about health and happiness at home. So keep the patient out of the hospital, keep him healthy, and with that health comes the combination of happiness because you keep families happy by keeping them together. You enhance productivity of companies and families because you've kept them healthy. So it is health and happiness at home. But it is the power of what we can do because of the moment of time we are in. It is the potential of India's high quality outcomes being juxtapositioned with the lower cost of care, and therefore patients from 120 countries coming to us, that is Heal in India. It is the power of India's demography, and therefore to enable our demographic dividend, we scale and we train and we skill people in healthcare. Therefore, a young India can take care of a graying world, and that is Heal by India. And it is the power of technology and AI, which is bringing healthcare into new dimensions of scalability and nonlinear growth and exponential growth. And this is Heal from India, remote care.
Thank you so much, Dr. Sangita, for taking out time and joining us.
Thank you.
And sharing your time and thoughtful reflections with us.
Thank you. Pleasure talking to you.